Hello, everyone. Okay, we can start now, I think. Yeah. Good afternoon, everyone. Thank you for joining to today's discussion. My name is Ratna. I will be the moderator for this afternoon discussion. Before that, I would like to recognize and thank you to Center for Southeast Asian Studies Indonesia that organized this kind of seminar, and also to all distinguished speakers who already accepted our invitation and here with us now. There will be 3 speakers for today. First one is Mr. Bayu Wirawan from Urban and Regional Development Institute, or URDI. Second is Ms. Aruminingsih from Ministry of National Development Planning, or BAPPENAS. And the last but not least is Dr. Kuswanto. He is from Center for Southeast Asian Studies. Ladies and gentlemen, today's discussion we will discuss about Sustainable Development Goals in Indonesia, challenges and responses to COVID-19 pandemic. We know that COVID-19 is unpredicted disruption and cause to many aspects of our development, such as social development, economic development, environmental development, and many others. COVID-19 caused economic depression even worse than ever. IMF April 2020 projection data showed that the economic development could be decreased up to -3, and it is lower than 2008 until 2009 when the global financial crisis was happened. The COVID-19 escalation remains to happen continuously, and it is affect not only to the global but also to Indonesia itself. BAPPENAS presents that in the end of 2020, the economic development in Indonesia will decrease around 2.3%, with the poverty percentage is around 9.4%. Of course, not only to economic development, but also to many other aspects. And today, our speakers will elaborate more and present their thoughts about this. All the speakers will have 10 minutes for the presentation, and after all, I will open for question and answer session, which participants can ask the speakers by leaving a question at the Zoom chat box while the presentation are presenting their thoughts. The chat box usually at the right side of your screen laptop. And this discussion will conduct in English, but if you wish to ask with Bahasa, you can leave the question at the chat box as well. This discussion is also live at our Facebook. Name is CSEAS Indonesia or CSEAS Indonesia. Okay, without any further ado, I would like to start. For the first one, Mr. Bayu Wirawan. Mr. Bayu Wirawan is a Deputy Director of Program in the Urban and Regional Development, or URDI, from 2018. He took 2 master degrees from the Institut Teknologi Bandung and also the University of Groningen in Netherlands. For Mr. Bayu Wirawan, you can start now.
Thank you. Thank you. Good afternoon, everyone. It's nice to see you all again in this webinar. We're still waiting for the presentation to be shown. Okay, let me start. The title of my presentation will be Local Governance SDGs Resilience to COVID-19 Pandemic. Could you next, please? Okay. This is a little bit snapshot of what happened by the COVID-19 impact in Indonesia. There are 70 agendas, and I will take several agendas that that come to my knowledge. The first is about the poverty. We know that the number of poverty become larger in Indonesia due to the COVID-19 impact. The lower tier middle class people become poor in Indonesia, and BAPPENAS also state that the COVID-19 is nullified or eroded the 10 years our effort to eradicate or alleviate the poverty in Indonesia. So we understand that how is very dire situation related to the COVID-19. And zero hunger, we know that there are some lockdown in Indonesian style, and it able to create a disturbance in food distribution, and in the long term, it can also happen to make food security in Indonesia. On good health and well-being, we understand that there are more than 1,000 people already passed away ahead of us. And then for the quality of education, the problem with the work from home is that we have an e-learning gap in the primary education, both of technological gap and affordability. Two things that come together is about clean water and sanitation and industry and infrastructure. We know that about around 50% of budget from the Ministry of Public Works is being diverted to the COVID-19 program. So let's say just this year there will be very decreased new development in infrastructure. About economic growth, the moderator already stated that we have a very low economic growth. The core institute already projected that around -2 until 2% of economic growth in 2020 in Indonesia. And there are about 5 up until 10 million people become new unemployment in Indonesia. Then there are two other modes. It's about responsible consumption. We know that where we are working from home or stay at home, we order much of food and they're using a lot of plastics. So in the short term or medium term, there will be lots of production of waste plastic in Indonesia. And related to the climate action, in the short term, some people say that it's good for the climate because the number of pollution become a little bit lower, but we don't know about in the long term, because when this situation become normal again, and then the government or everyone try to push back the economy, and the climate situation could be much worse than previous one. Next, please. Next. This is the idea for the related to the education gap. We see that I try to capture the internet connectivity in Indonesia. We can see that based on the one of the largest provider of telecommunication, not yet, please back please. We can still see that there are some area in Indonesia that not yet covered by internet. And when we talk about resilience, it's a concept about how the system can be bouncing back again to the normal, whether it's change, adapt, or transform. There are three kinds: changing back to the previous condition, or little bit change from the different situation, or trying evolve to something relatively new. It's a reminder for us about the resilience. What is the resilience? Next, please. When we talk about SDGs, we know that SDG implementation is very important. It's governed by the central state government, and then due to the decentralization, the subnational government has a strategic role. The subnational is the province and the district government. So why the districts or why the subnational become important? Because they are closely related with the people, with the site level, and then they are the one who doing the real public service. So the real effort to achieve the SDGs is the local level. Next. Okay, when we talk about the local government, we can see that the local government, let's say this is the district government, already have a lot of responsibility. At the national level, they have a lot of programs that they need to be adapted, such as the National Special Plan, and then Climate Change Adaptation National Action Plan, then and others. And also there are some international issues, such as World Urban Agenda, and then we talk today about SDGs. There are low carbon development issues and biodiversity. So a lot of this agenda come together and become the responsibility of the district government for the enactment. And they also, at national level, there are several indicators to measure how the local government doing their or perform their daily activities. There are at least 4 that we can identify from URDI. There are IKPPD, basically how to measure the local government performance is by the Ministry of Home Affairs. And then the Human Development Index is joined with the National Statistics Agency and Ministry of Social Welfare. And then we have the LAKIP, and it's basically from the Ministry of Administrative and Bureaucratic Reform. And then we have the LKPD, Local Government Financial Report, is from the National Auditing Service. And then we need to understand each district have their own comparative and competitive advantages. So based on this, the contextualization has become very important to make the district government understand and have their sense of ownership about how to manage the SDGs. Please next. How to contextualize? We and URDI have some term, we call it jurisdictional capacity. It's about how the local government understand their inner capabilities, and then at the some administrative area, this is why we call it jurisdictional, because a district and other district, they have their own needs, and that's why we need to understand what based on the administrative level. And also this capacity also consider about the regional characteristic. They have their own social, cultural, economical problem or the economical advantages. So it's the basic, the jurisdictional capacity is the basic aspect of local government to determine how the programs, policy is about to supporting the global or national agenda, which is SDGs, without ignoring the capability or the character of the local government. That's why, can you next please? For the SDG, we see like this. We identify the subnational jurisdictional capacity through three aspects, which is the effective leadership, political communication, and political management. This is mostly about how the political leader able to come up with their idea and become the prime mover, and then how the policy making in institutional arrangement can be done in the area, and then with these two, they can create a more integrated development planning and budgeting. In the end, they are able to get high quality and public service based on the local characteristic, and we can contextualize in SDG. We can see that how this talk and a lot of the indicators can be combined together and then to answer the SDGs. Next, please. I have to explain well of how the local government doing their jurisdictional capacity. The first one is Kulon Progo Regency. The second one is Banyuwangi. Both have the similar situation or not situation, have the similar traits. They they improve their public service by improve their performance, whether by bureaucratic reform or public sector management. And both of these regency also promote more inclusivity in their program. And the most important is they also change their way of their budgeting and programming from program follow money to money follow program. So they create both of kabupaten set a goal about what needs to be done in the 5 years or the 10 years, and then they working together to achieve the program. So they diminish the silo inside this inside the government agency. And how they do that? They use the local character. For example, Kulon Progo, they buying their own rice, they buying their own batik, they're buying their own water, drinking bottle for the people by themselves. So they promote more consumption in the area. And then they also have what they call it Tomira, toko milik rakyat. It's basically almost the same as any small convenience store around us. But the Bupati then stopped the new development or halted the development of chain a small convenience store, and then he promote the village enterprise to become their management of this store. Of course, they still have cooperation between the Tomira and then some convenience store, but again, it's about how the Bupati promote the local people to use their own economic and advantages. For the Banyuwangi, they promote much further by using the electronic or ITC until the village level. So they make sure that all the programming, all this discussion, able to capture from the lowest level of the government. And by doing so, they're able to make sure that the public service can reach the people throughout the kabupaten. Next. In conclusion, I would say that the district with a strong subnational jurisdictional capacity, which they understand their own needs and resources, they are able to more resilient. I think they are more resilient during this pandemic when something hit them, and they already have the system to make sure that they can work within their own resources. I believe that they will be able to bounce back quickly to the normal situation, whatever the normal is, whether it's going back to the previous one or changing a little bit to become something else, or literally evolve into something that we probably not seeing now. So that's why I could say that the local resilience is very important to make sure that how to answer the challenge of this pandemic level. That's all that I can say for this afternoon. I will be forward for any question and discussion for later. Thank you.
Okay, thank you, Pak. Thank you, Pak Bayu Wirawan, for the presentation. Yes, I can take note for the most important thing from Pak Bayu. Subnational jurisdiction of local government has very important role to reach SDGs at the local level. Okay, I will next to the second speaker is Ms. Aruminingsih. Ms. Aruminingsih is a regional planner of the Ministry of National Development Planning, or BAPPENAS. She took master degree at the University of Groningen, Netherlands, and now becoming PhD candidate in the School of Environmental Studies, University of Indonesia. Ms. Aruminingsih is a fellow research associate at Collabora and also member of U-Inspire, or Youth and Young Professional on Innovation, Science, and Technology platform, also co-founder of Engage, member of IABI, and also member of PPPI. For Ms. Aruminingsih, time is yours.
Okay, thank you, Ms. Ratna, for the introduction. Okay. Your Excellencies, the ambassadors of Asian countries to Indonesia, Your Excellencies, directors of CSEAS, Bapak Arisman, and also distinguished colleagues and participants of today's webinar series. Assalamualaikum warahmatullahi wabarakatuh, and very good afternoon to all of you. So I'm very happy and also excited to be able to be here along with Pak Bayu Wirawan as the Deputy Director of Program URDI, and also Pak Kuswanto as the Senior Researcher of CSEAS. I hope this event could be a productive discussions. So start from the introductions. I'm going to present about the new normal, a new approach towards the SDGs implementations. And as shown in the cover, my entities quite varies because I'm a regional planner in the Ministry of National Development Planning, or BAPPENAS, and I'm also, as introduced before, I'm also a fellow associate of Collabora, and also member of U-Inspire, co-founder of Engage, and also member of IAB, and also member of PPPI. So basically, these are the platforms for planning, disaster management, and also for geography field. My standpoint here, my presentation is based from my views perspective from my backgrounds. So maybe we can start from the first slide. I'm going to share a short story. So click. So once upon a time, so this is going to be like a brief story. Okay, next click. So well, basically in the year of 2012, next, there's a long process of making the SDGs. Even though we acknowledge that the SDGs started in the year of 2015, well, actually the high-level committee is already started the process in the year 2012. And I really remember and recall the process that BAPPENAS firstly introduced the concept of SDGs is in the year of 2014. If you see and you read the descriptions on the slide, these are the I think interesting part of the process, because the negotiations and also the constructive debates is happened in the year of 2014. We are over the 17 targets and also 169 indicators, and in BAPPENAS, along with the line ministries, we have to like design and also make a program and activities that in line with the 17 targets and also 169 indicators. So it's like a long process of making the SDGs. And in the year of 2015, the President Regulation number 59, 2017, Perpres nomor 59 tahun 2017 about SDGs is being launched. So please click. I'm going to invite you to take like a brief review of the MDGs, because we've already heard about the SDGs, MDGs. Let me share you like a little or just a slight description about the MDGs. Next. Okay, so as we know, before the SDGs, there are MDGs that being implemented throughout countries worldwide. So when we create the SDGs, we take the lesson learned. There are 15 lesson learned here. I'm sorry, I combine it with Bahasa Indonesia. So what we can take as insights from the MDGs is the legal basis and also the guidelines and also the monitoring, evaluation, and also reports that need to be enhanced when we have to implement the SDGs. And also we have to acknowledge about the local champions. Means that, for example, we have to appreciate and also acknowledge the local governments and also the local leaders about the implementation of the MDGs. So based on this 15 lesson learned and also the brief review of the MDGs, we move on to the SDGs. So next slide. This is the recommendation and follow-up. So based on those lessons learned, there are 6 recommendations for SDGs and also the 3 important follow-up. So basically the first is we have to finalize the MDGs reports, and it was being launched on March 2016. And also we held an MDGs awards that being given during the Muslimbangnas. If some of you haven't aware of or maybe haven't know about the Muslimbangnas, it is like national development event that accommodate the central government and also local governments to be meet in a forum and then make a collaboration to create annual working plan or RKP. And the final step is to preparing the SDGs. So these 3 slides emphasize on the long process of the making of the SDGs. Next slide. On the next slide is the President Directive during the Cabinet meeting that held in December 25th, 2015. So there are 3 main directives of presidents that being elaborated. The first is to optimizing the coordination roles of the Ministry of PPN BAPPENAS. So no wonder that the SDG Secretariat or Secretariat SDGs is attached to the BAPPENAS because we have to inline the LPJMN and SDGs. And the second is to involve all the stakeholders from government, parliament, CSO, philanthropists, business, experts, and academics. And third, the organization is also being pushed to be strategically operational. Next slide. This is a quick review. So based on those process, we finally can elaborate. There are 17 goals, 169 targets, and for Indonesia, there are 241 indicators. And it is divided into 4 pillars. First is the social pillars. Second is economic pillars. Third is environmental pillars. And the last one is the management pillars, law and management pillars. But I mostly involved in the environmental pillars, even though that I also discuss about the other 3 pillars. Next slide. So in sense that the SDGs is perfecting the MDGs, there are 7 strategies that are being implemented. First, the SDGs has to be more comprehensive. And second, it has to broaden the sources of funding. Means that it started from the government, private sectors to other resources. And third, to emphasizing on basic human rights. 4, inclusive. 5th, involve all the stakeholders. And 6, because the SDGs is the continuation of the MDGs, it has to reach the 0 goals. Poverty becomes 0 and other global issues. And the last one is the means of implementation. We have to find various ways to make this succeed. Next slide. Next slide is the strategy for implementing the SDGs. Basically, there are the principle of the SDGs and also the regulation and also the technical guidelines and the supports from all the stakeholders. So you can see all of these components, all of these factors is being combined to create the success of the SDGs. And this is the steps for SDGs implementation. Let's click. Okay, please click. Okay, so this is the steps for reaching the SDGs targets. But I add the word but. Okay, next slide. Well, in the early year of 2020, we have faced the pandemic, the COVID-19 pandemic. Even though in China it started earlier, in Indonesia, we just recognized the COVID-19 later on, like during the month of March, because the social distancing policy is just started on the March 16. So I think it's almost like more than 2 months that we have implemented social distancing policy. So you see, this is my paper with my colleagues about the government response to COVID-19 in Indonesia. We can see that all of the budget, all of the resources has been pledged to defend the global economy against COVID-19. And Indonesia is one of the countries that also face same problem. Next. Okay. Can you just click several clicks? So the history writes that the initial coronavirus is started in China, and then the victim is add on the number. Next slide. Sorry, just click. And then we heard several news, like for example, like people dies in the street. Like, is it like the real news or hoax? Next slide. Okay, and then also about the doctor and the hospital, there's so many problems. Please click. Okay, so you see, okay, please click again, click. So the COVID-19 pandemic spread all over the world, and it's not only the health issue, it's also the economic issue. Please click. Yeah, the stock being collapsed, and then also Indonesia facing the issue of lockdown. Next slide. Okay. And also I have to emphasize this, that the COVID-19 pandemic is not merely an health issue, but it's also a social issue. It's not only economic issue. So it is very multidimensional issue. Okay, click. And then every day we are faced by the news of the COVID-19. Click. Okay. I just make like trivia or just like a simple search in Google. I'm Googling. If I type COVID-19, we will find almost 3.5 billion search. So there's like abundance of news, abundance of information that being presented in front of us. So yeah, there's so many news that we have to filter and to find whether it's true or not. Next slide. Okay, and this is the report of COVID-19 in Indonesia. The source is from BNPB and also the Ministry of Health. And then it being analyzed and also being presented in mass media, so the public can receive the information. And as you see, the graphic, well, honestly speaking, the graphic show that it's not slowing down, yeah. It's still on peak, but we hope so after the highest peak, it can be declined. Okay, next slide. Okay, so the question is, what is the new normal? We heard it, maybe we overheard like the new normal. So what does it mean in the term of COVID-19 pandemics? Next slide. So related with our topic today about the SDGs, as I mentioned before, the COVID-19 pandemic is not only about health issue. It's mostly about economic and also social issue. So you see that several targets of SDGs are being affected. First, about the ending the poverty in all forms everywhere, and also the third target, 8th target, and also 11th target. So how to make like a resilient community if pandemic COVID-19 is still everywhere? Okay, next slide. This is I quoted from the presentation that being presented by the Ministry of BAPPENAS, head of BAPPENAS. So this is the several types of policy that being implemented if we consider about the virus containment and also the economic policy interventions. Next slide. And I presented you the outlook of the development target in 2020 and year 2021. After the pandemic COVID-19, we have to make a corrections in our development targets. We have to make it more accessible. We cannot put optimistic target in this time of COVID-19. So you see, if the realization in 2019 is 5.02%, and the RPJMN 2021 is still around 5.4 to 5.7, and then in the Outlook 2020, we make corrections that the economic growth might be in the stage of 2.3%. And also there will be increasing numbers of unemployment. There will be 4.22 million people that are being unemployed in 2020, while the field of job, the job position is only 2.3 to 2.8 million people. And also people that live below the poverty line will add around 2 million people. So this is like a bitter truth or like the hurtful reality that we have to face. It doesn't mean that we have to be pessimistic, but we have to find and we have to consider this kind of data and also consideration when we make planning and also when we make strategy. Next slide. So if you see the orange box on the right, yeah, okay. If the resource of or if the funding resource is being decreased, it means the development target will need to be justified. And it is not only happen in Indonesia. And if we next slide, and if we speak about the global target, we have to reconsider if the targets is accessible or need to be justified in this time of COVID-19. Okay, this is so in response of the COVID-19 pandemic, the government create policy and also strategy, and this is the President Directive during the MDGS. And then next slide. And this is the social support atau bantuan sosial ya, bantuan sosial that created by the government to help for the marginal community and also people that live under the poverty line. Next slide. Okay. So this is the policies that being applied, PSBB, the social distancing policy. You can see there are various types of social distancing. Next slide. And also the time range is quite different. For example, Jakarta, the social distancing is started on April 10th. And then hopefully will be end in May 22nd. While in, for example, in Kota Banjarmasin, it started on April 24 and finished on May 7. This might be prolonged. We will see about the updates. Next slide. And also, in social distancing, it also apply when we do the traveling and also when we using car transportation. Yeah, so there are regulations about this, and we need to follow during the social distancing. Next slide. And we also make a mapping of the social support distributions. Start from the PKH, kartu sembako, until the bansos. Okay, next slide. While COVID-19 is not always have a negative impact, we have to be fair. Actually, the impact of COVID-19 to air pollution, gas emissions, and waterways has a positive impact. For example, the air pollution is dropping off nearly 50%, and also the greenhouse gas emissions in China, because in China there's like a massive consumption of major coal-fired power stations. So the carbon brief reported that 25% drop in energy use and emission in China. And also the waterways are becoming more clear. So these are some kind of good side effect of the COVID-19. Next slide. This is the publications that shared by the BAPPENAS. Hidup normal berlaku di bulan ini, Juni, with a question mark. So it is expected that we have like 5 cases. Phase 1, the B2B, the business to business, will be operated again in June 1st by applying social distancing. And the second phase on June 8, 2020, the market and the mall will be operated again. And phase 3, schools and also the cultural places will be reopened, of course, by applying social distance policy. For place on July 6, 2020, the restaurant and also the religious buildings and also facilities like mosques, church, and others will be reopened. And the last phase, the fifth phase, on July 20 and July 27, 2020, the economic activity is expected to be normal again. Well, we hope so. This is like living normal, but living the new normal, because we have to follow the mechanism of social distancing policy. And my last slide, you can see that COVID-19 pandemic is a disaster event that abrupts the normal system or business usual scheme. And it is a huge impact that affects nation economy. So to avoid economic collapse, there should be an adjustment in SDGs targets since there are adjustment in country's budget. And second, in decision-making process, we have to apply technocratic planning methods based on data, information, spatial and statistic analysis, patterns, and projections. Because we can only make a policy based on the right information. 3, there should be two-way approaches for COVID-19 management. First is short-term technical approach, and second is one-to-many beneficial approach. And fourth, please click. The adaptive and resilience are the two keywords for the new normal. In terms of adaptation towards COVID-19, there should be various scenario built from best case scenario to worst case scenario. And the last one, this is the important one, we have to create a resilience community as the new normal towards COVID-19 pandemic. There should be SDGs driven policy to create a resilient community with positive adaptations. Why I emphasize positive adaptation? Because adaptation can be positive and negative. Positive adaptation means that we create resilient community that we handle the problem. But if we create resilient community with negative adaptation, they just letting it loose, like this is like the way we live without any mitigation or prevention. So Indonesia, we have to admit that Indonesia is still in a disaster phase. So the grand design of the new normal during and after the COVID-19 pandemic should be created as soon as possible. I think next, I think that's all of my presentations. Questions and also inputs are really encouraged. Thank you very much.
Yeah, thank you very much, Ms. Aruminingsih. Yeah, thank you very much for Ms. Aruminingsih. I noted some point from you. Thank you for elaborating the SDGs and also the MDGs. Two keywords are very insightful and we can discuss later. Now moving to the third speakers, Mr. Kuswanto. Mr. Kuswanto is a senior researcher of Center for Southeast Asian Studies. Mr. Kuswanto is the senior researcher of Center for Southeast Asian Studies. His research interests mainly on sustainable development, foreign direct investment, local government, decentralization, and local economic development. He holds PhD in International Political Economy from University of Groningen, Netherlands, and Master Urban and Regional Planning from the University of Colorado, Denver. He graduated his bachelor from National Institute of Local Governance, West Java, majoring in Public Administration. For Mr. Kuswanto, time is yours.
Thank you, Ms. Ratna. Thank you for nice introduction. In this opportunity, hello.
Yes, we can hear you, Mas.
Okay. Yeah. In this opportunity, I would like to share my thoughts on how COVID-19 pandemic affects sustainable development, and also how could we utilize Indonesian capital to. So I will begin with a story. So in April Uh, in I read a newspaper telling that hello, oh, hello, telling the things that Indonesian people has raised fund about almost 200 billion for to help the government cope the COVID-19. It is quite surprising. Indonesian people is very amazing. Therefore, I have an idea. Why don't we utilize this kind of social capital that we have to cope the COVID-19? And what is social capital? I would say in a very simple term, social capital is the ability of people to work together for the common purposes. And in this presentation, I also only emphasize four targets, four goals in the social development goals, which are number 1 to number 4, which is related to social development. Continue. Yeah. Before we begin to how do we utilize our social capital as a capital to cope the COVID-19, I would describe how bad the COVID-19 affect our daily life. According to the Semeru Institute research, Indonesia after COVID-19, about 9 million people fall into poverty. The number is quite big, and about 2 million people lost their job. So according to the research, the poverty rate will increase from 9.2% to almost 13% in 2020, only within 3 months. It's quite shocking. And that is the impact of the COVID-19 on poverty. Continue. Another bad news is in terms of the food security. Before COVID-19 pandemic itself, Indonesia is under threat in terms of the food security. According to the data from the Global Hunger Index, our index is about 20.1. It means it's serious. We will face the hunger problems in Indonesia. The indicators are coming from 4 indicators. The proportion of people undernourished in Indonesia is about 9% people are undernourished, and 31% children are stunting. Around 2% mortality rate under 5 years, and 11% prevalence wasting children under 5. So this is the baseline, the situation before COVID-19. And also the fact that Indonesia is the food importer. Around 1.5 million ton of rice are imported from Vietnam and Thailand. And in fact, due to the COVID-19, those countries and many countries, they stopped the exporting their product because of the increase of the demand from the domestic. So Indonesia is very fragile in terms of the food security. There is a must something that the government should do to avoid that food crisis in the future. And the third, continue. The impact of COVID-19 on health. It is very clear that COVID-19 has a lot of impact on our health. Without having to do a research, we also know that it must be a very dangerous for us. But for Indonesian itself, our health system will be collapsed if we cannot manage it properly. Our capacity, according to data from the WHO, the hospital capacity is only about 1.27 beds per 1,000 of patients. So the number is quite low compared to the standard is about 5% per 1,000 patients. And if you can see in this chart, you can see the Jakarta is the city, the province which has the best capacity of hospitals to treat the COVID-19. You can imagine if the cases in Indonesia is just like in Spain or Italy. I cannot imagine how can we handle that problem. It can make our system collapse. And also another problem, we lost already 44 medical professionals due to the COVID-19. The number may be increasing or maybe some data still uncovered. And also we know that we face some shortage of the medical equipment. Continue. Please continue. Yeah. And the fourth, no, please back to the education part. As Mr. Bayu Wirawan already said before, that the COVID-19 has significant impact on education because our infrastructure related to internet and IT technology remain limited. But in fact, here is data from UNESCO. All around Indonesia, the schools are almost closed. Every school are closed, and about 68 million students are affected. In fact, according to the data from the Child Protection Commissioner, they conducted a survey about how the working and study from home are going on. They found that actually only 8% of teachers are familiar with the IT technology in teaching. Can you imagine? 92% they are not familiar with these things. And also there are about 38 students do not use internet. So it means that the quality of education will be affected in the long term. If we continue the situation in this way, I believe that our quality of education will be affected. Currently, our PISA score is also quite low, and I am afraid it will be lower if we continue the situation like this without any significant measure to be taken. And please continue again. I am happy that the government has taken several measures, although that still there are many critics on what the government does. But the first thing that the government already conducted, established task force, special task force for COVID, and already determined some referential hospitals, imported some testing kits, and also conducted some, we call it Indonesian lockdown. In Indonesia, I think in the law, we know some level of lockdown, and Indonesia has taken like large scale social restriction. It is kind of the physical distancing. Actually, this measure is highly dependent on how disciplined the people are in Indonesia and how serious the government's commitment to protect the Indonesian people. So actually, it cannot be separated if the government doing right and people are not doing right. So this measure will not be significant. And also the government already provided some economic stimulus. And what we want to discuss is about how effective those measurements. Continue. Please continue. Yeah. No, please back to the previous one. Previous one. Yeah. Why I know the charitable one. Why I choose that we need to utilize our social capital to be successful in coping with COVID-19 pandemic. Because in fact, please continue. Indonesia is one of the most generous and most charitable communities in the world. So it is a very, very big potential that we can utilize. For example, only within a couple months, almost about 100,000 social civic organizations are active involving in helping government coping with COVID-19. It's quite significant. And two, the biggest organization in Indonesia, NU and Muhammadiyah, Nahdlatul Ulama and Muhammadiyah, they established their own task force to cope the COVID-19. How can you imagine? It is a very big potential to cope COVID-19. And also learning from previous experiences in Yogyakarta earthquake and tsunami, we have proven to the world that Indonesian people are resilient because of all people are very active, very engaged in the process of recovery. So I think that are the reason why we have to utilize the social capital that we have. Please continue. Please continue. And how to please back again. How to utilize the social capital. I will use a case study in Banyuwangi. Actually, I did a research on Banyuwangi, how the government and people of Banyuwangi can reduce the number of poverty from 2 digits, from 20% into only 7%. There are several actions that they took. For example, they have program called Gentong Seribu, that every person in Banyuwangi put the money, and the money is collected to help others. And although there are some programs such as Garda Ampuh, gerakan anak angkat muda putus sekolah, so it's kind of the movement to help the student who drop out from school. And also there is some program, a program called Siswa Astu Sebaya. What the government does as a commitment, there are some requirements to be successful in conducting some programs like those. First, there must be a strong commitment from government. That is necessary, because without strong commitment, people will not trust their money. They will not put their money. They will not help the government. So first is the strong commitment. And the second one is there must be open and data transparency. In Banyuwangi, they open all the recipients of the funding very open, by name, by address, and the government only direct the channel. All like civic organization, people, community, they put their money, and the government only direct the channel. They put the data. So it means that there is no people which get more than others. So it's ensure the fairness. And also the third requirement is flexible budgeting system. In Indonesia, we have to understand, and also we might know, that our budgeting system is not flexible. It's very rigid. It can become handicapped because during a crisis, we cannot be rigid. It should be more flexible. So, and the fourth, the roles government is to provide general plan and data. So actually, there are a lot of resources that can be utilized, but the government need to provide the general plan and the data which is valid to mitigate the people who will affected the most. So that is the most important things. We also understand that the data is always a problem for Indonesian people. And the fifth and the most important things is the strong rule of law. We know in every country, in every local government, there are always free riders and rent seekers. If we do not enforce the law, all good programs will not be beneficial for people, will not success. All program will be failed. So strong rule of law is the necessary. I think that is my thought regarding the COVID-19 and the sustainable development goals in Indonesia. Thank you for your attention, and I'm open for any questions to be discussed. Thank you.
Yeah, thank you, Pak Kuswanto, for the presentation. And from Pak Kuswanto, I learned about how to utilize social capital in case of to face the challenge of COVID-19. So after that, I will move an open floor for the question and answer discussion. Let me see to the chat box. Here, some question already in the chat box. If the participants want to ask, you can leave a comment or a question right now at the chat box. The first one from Rizky Azita Iskandar Putri to Bapak Bayu Wirawan. Ms. Zita said that post COVID-19, any improvement to the local government resilience, referring to your presentation on battling COVID-19 impact with subnational jurisdiction capacity? Are we really going to back to normal or new normal, as another speaker presented? That's the first question for Bapak Bayu Wirawan. And for Ms. Aruminingsih, Ms. Alvina asked about, due to COVID-19, will SDGs be remain achieved since this pandemic affects to all sectors over the world? Thank you. And for Pak Kuswanto, there is a question from Siti Rizkia Amalia. She asked about social capital is really depend on the characteristic of every region in Indonesia. It could be different in every places. If social capital could be developed and how? Yeah, maybe Pak Bayu Wirawan can answer for the first time, and then followed by Ms. Aruminingsih and Pak Kuswanto.
Okay, thank you very much. I will ask. Thank you for Ms. Rizkia about your question. Is there any improvement to the local government resilience? We have to see that we have about 500 local government in Indonesia. So each of them have their own characteristic. So if you ask about any improvement, it will be back to them. If they're able to move forward from their pet dependence, from their old habit that doing the thing that they always do, and they came up with some new ideas, and then yes, they should have to more strong resilience related to this pandemic. And are we going back to normal or new normal? Is based on my first statement. If the local government already moving forward to better situation or better system, probably they just little bit different normal or back to their normal. But if they still lack their own capacity or their lack of capacity they have lack of capacity, they need to change themselves, and then absolutely they have changed to the new normal. So it will be different kind of government, it will be different kind of people, and if you ask about globally, it will be very hard to tell because every government has their own pace. Is there This one, Ms. Ratna?
Yeah, Pak. Maybe we can next to Miss Aruminingsih. Yeah, thank you.
Okay, Ms. Ratna, who's the name of the person that asked? Sorry.
Okay. Alvina.
Oh, okay, yeah. Thank you, Mbak Alvina, for the question. It's very straightforward questions, but also difficult question to be answered. So, in the term of the COVID-19 pandemic, that's the target of the SDGs still be achieved. So, yeah, it's quite straightforward questions. On answering those questions, we have to reflect it on those 7 targets of SDGs. First is like no poverty in the world, like, and then the 16 other targets, including the peace, justice, strong institution, partnership for the goals. So as in my understanding, the outcome of the SDGs could still be achieved because the essence of the SDGs is the development itself. The development is not about building infrastructure, it's not about creating constructive building, but it's about to shift it from the bad or less conditions into the better conditions. So that's the essence of the SDGs. So in terms of that definitions, I believe that the SDGs will still be achieved. But when we talk about the details, like about the units, about the outputs, about the nominals, I think the most realistic way to do is to adjust that unit of targets. I think that's my perspective on that. Thank you, Mbak.
Okay, thank you, Mbak Aruminingsih. Next, Pak Kuswanto, you can respond to the question from Siti Rizky Amalia. Pak Kuswanto?
Yeah.
Yeah, okay.
Can you repeat your question, please?
Okay, here the question, social capital is really depend on the characteristic of every region in Indonesia. It could be different in every places. So is social capital could be developed and how to develop it?
Oh, okay. Thank you. Very nice question. So actually, social capital exists already. It does exist in every community. And what we do is we do not develop, but we have to enhance the quality of social capital. So many things that we can do. For many Western countries, they build such environmental design to enable people to communicate more often. So that's one part of the mechanism. For example, they develop more parks, more recreation room, etc. And also they support the local association because hello?
Yeah, Mas, we can hear you.
Yeah, okay. Because in many occasions, public whole general population, they tend to be focused on themselves, but there are several people who are very active engaging in community. So we have to like the government have to support this kind of people, the civic organization, so and put the trust to the people of doing what they need. So those are example of what many European countries do to enhance the social capital. In Indonesia, maybe we also have some program like Siskamling, Gotong Royong, etc. That is part of the method to enhance the social capital. So we cannot develop, but we can enhance. Thank you.
Okay, thank you, Pak Kuswanto. I will next reading the question from Emma Tusianti. She asked about maybe to Pak Kuswanto, Miss Aruminingsih, and also can be answered by Pak Bayu Wirawan. I heard that the most vulnerable person is women because the impact of COVID-19 is not neutral gender. Women is negatively affected social, both economical impacts. How BAPPENAS respond this and how social capital apply on this issue? Yeah.
To answer first.
Pak Kuswanto, if you want to.
Okay. Okay. So that is right. That women is most vulnerable person who will get affected in every crisis. You know, for example, it is such as an illustration for a man who worked and got laid off. They still have like a week to think what they have to do. But women, right away when their husband got laid off, they will get infected because they have to manage the family financial, and it's right away. The impact is very right away. So in fact, that is the direct impact. Another impact is like the husband, they tend to be more temperament, etc., and the women will like get another impact from the husband, etc. There are many illustrations. That is the right one, that the woman is most vulnerable, got impact from the crisis. And how social capital can help those. Actually, this is my experience. I have engaged with many of the communities, and whenever they got impacted, those women, they work together. They tell the stories to other women, and then women they form such communities. And the simple ways that they just help each other. For example, they help the other neighbor to take care of the kids while this girl get working, something like that. That in very simple. So that's mean the social capital. So actually the social capital means like mutual trust, and always the similar feeling, the same have the same problems and help each other. So if you can see in currently, maybe you can see, look around your neighborhood, you will see that many more women selling their food product to other neighbors, and they just like exchange. So it is an example how social capital works, and it is very natural. So what we do, we have to enhance and give them more room. Like we provide some funding to help them doing their activities, like in PKK or something like that. So I think that is my answer. It is based on our daily activities. I hope it can help. I hope it can answer your questions. Thank you.
Thank you, Mas Kuswanto. Mbak Aruminingsih. Yeah.
Okay. Thank you for the question from Ms. Nenden Rahayu. And also, I will to highlight the statement. It's quite a bold statement. The impact of COVID-19 is not neutral gender. In some extent, I agree with that statement, and I strongly agree that the impact of COVID-19 is affect women, but also in a broadened term, it affects the marginal community, like it's not only women but also elderly, children, people without social protection. So those marginal community that are mostly affected by the COVID-19, and because of those mapping and identifications, we have the government have to strategies. First is the short term, and the second one is the long-term strategy. The first one, the short term, is we have to provide the social net, like jaring sosial. For example, like a few weeks ago, our my divisions have had meetings with the Director of Social Protections, and then we kind of discuss and also make initial mapping about who's the target group that receive the help or the assistance from the government. And we follow the President Directive that the grant, the assistance, or the bansos or the dana desa, the BLT dana desa, for example, should not be overlapped between the marginal groups. For example, we have program Keluarga Harapan (PKH), and also we have program sembako, and also electricity subsidized, and also bansos DKI Jakarta, ada kartu prakerja. So aside of the pro and contra of the issue, the government has provided the social assistance for those marginal community, including women. And for the long terms, we have to recover the economy and also provide jobs and economic activities for people, and also same opportunity for people, including women, to work. I think that's my response. Thank you.
Yeah. Okay. Thank you. For Mr. Bayu Wirawan, do you want to add some point for discussion?
Okay, I will also try to answer this Miss Emma question, and there are one again. What is basically, yes, I agree that women might be very affected by the COVID. The most vulnerable COVID victim for the society in economic sense is in the short term, I believe it's the new poor people. New poor is the people who live previously as the middle incomes, but in the lower tier, and then during the COVID they become unemployment, and then they lost their income, and then they be part of the new poor. They are the most vulnerable, and then because at some point the lower poor people already have their data in the government, and the government able to easily direct their aid for them. But the new poor, the government do not have the data. They have to update it, and at certain point it can be done in the very short time. So we can see that this new poor will be very hard for them, and they have to sell everything. But Kuswanto already give his example about how in the end some women have to become the source of money for the family by selling food or other services. So this is the short-term situation. The new poor, they become very harder. They don't have the income, and then the woman must take care the family because the husband probably not able to get a new job in the short term. But in the long term, everyone in the poor community will be very much affected because we don't know how much longer the government able to support all of them. In the previous interview with in the Mata Nasional program, President Jokowi said that if he want to support Jakarta people only for the lockdown situation, he said that it's about 500 billion per day. So we can see that the government won't be able to doing help the people for the long term. So we must. The answer is we must to combine the government effort and the social capital effort. In his presentation, Pak Kuswanto already said that how the Banyuwangi, the local government already have the system, they know the people, and then when the social capital came, they easily funneling those aid. So this is the most important thing to do about the most vulnerable people in the country during this pandemic. Thank you.
Okay, thank you, Pak Bayu Wirawan. Maybe for the last question, maybe for this is for all speakers, and all speakers can answer for 1 or 2 minutes, maybe 1 minute better. This is from Ms. Nukila Evanti. Thanks for the presentation from all speakers about the rule of law. What do you think the challenges in its implementation in Indonesia? Maybe Pak Kuswanto, Bu Aruminingsih, and Pak Bayu Wirawan. Thank you.
Rule of law is always the challenge in every country, especially in developing countries. I don't know that we already live up from developing into developed countries yet. We are now not developing anymore, but we're not developed yet. So yeah. But rule of law is highly dependent on how the government manage the governance. So actually, it is a bit difficult for Indonesia because we have a very free. We have like freedom, a lot of freedom, and we have like social media. We have just like every click, and we can share our experience. And then on the other hand, the government, like the police, they faced some difficulties in interpreting the law. Say our law itself, we have like a very multi-interpretative law, and then in the field, the police and the executors, they are confused in implementing that policies. That's one problem. Another problem in terms of the rule of law, we have to acknowledge that in politics, a lot of interest, in a lot of political interest and individual interests influence the policy making process. So sometimes what the government decide as a policy is different with what many people think, because it influenced by some individuals around the president, for example, or around the power. It's happened in many countries also. That's also a problem in terms of the rule of law. And the third problem is about the people itself. Sometimes we have to acknowledge and we have to confess that Indonesian people sometimes is not very disciplined. So whenever the policy already been adopted, and when the policy itself does not have like punishment, strong punishment, and we just like Indonesian people, like, okay, that must be no punishment at all, or the punishment is still fine for me. So yeah, so then the people think that's okay, just violate the law, violate the regulation, but that's everything is gonna be fine. So that's part of the culture that we have to also think to improve, I think. So if I say that the law itself has a problem and the executors has the problem, executors and policymakers has the problem, and the people itself has a problem. So that's my answer for that question. Thank you.
Okay. About the question from Ms. Nukila about the challenges on implementing the rule of laws. Yeah, we cannot close the facts that from the recent news we see that there's so many people that disobey the social distance policy, for example. I can share like a brief information. when I was involved in Indonesia Development Forum, like several years ago, I noticed that local or people and also the province and municipality that are being more developed than others, usually because the factors of the leaders. But aside from that, this is not only the single factors. On implementing the rule of law in the context of the COVID-19, I think several factors that need to be considered is first the transparency of the data, because there's so many abundance of data, and we are not underconnected, we are overconnected. And the cause of the overspreading the COVID-19 is also because we are overconnected. And second, not only about the transparency data, the second is to educate the people about the cause and the consequences. We acknowledge that people in Indonesia, I think people in Indonesia is really smart, and they're really dynamic, but in other side, some of them tend to be laid back. So it's very important for the leaders of the local, in the provincial or even the municipality to educate the society about the facts, about the data, and the transparency, and also the cause and the consequences. And I noticed that there's a good practice in Indonesia. It's not always bad examples. For example, when some people disobey the rules, they need to clean the roads. Yeah, so it's really a micro example, but it's quite effective. So in that way, I can conclude that first it's about the leadership. Second is about transparency of the data, because if we don't provide the data, people will think that the government will like make a bad decisions behind the closed door. So that might be came up to people ideas. And the third one is to educate the people. I think that's all.
Okay, maybe for Pak Bayu, you want to add, or maybe just one sentence or short?
Yeah, short one. Okay. Ms. Arum and Pak Kuswanto already told almost everything for the question, but I would say that sometimes the challenge of the laws is kind of one size fits all for all Indonesian. However, we know that Indonesia is very diverse within its district. So to able to answer the challenge, the local government needs to understand their own characteristic to uphold that law. If they use the law, for example, if you use Jakarta, like Jakarta style or Bogor style laws toward the COVID-19, is it effective for the local people? We can see that for one good example is in Bali. They utilize the what we call pecalang to help the local government to enhance to uphold the laws. So this is how the local government use the local capital, social capital, to help them to uphold the laws. And it's been easier for local people to understand the law because it's being managed by the local people ourselves. So that's my idea about how to transfer the challenge of the laws of the law.
Okay, thank you so much for Pak Bayu Wirawan and all the speakers. Now we are in the end of our session. I will not conclude what all speakers said, but I have some important notes from the idea from the speakers. The first one, COVID-19 caused too many aspects in our lives as well as affected to SDGs goal number 1, number 2, number 3, number 4, etc. Local government has important role for building resilience at the local level by knowing what their needs and resources. Utilizing and building a strong social capital also could be one of the key answers for facing the challenges of COVID-19. The role of leaders and transparency of data will be more useful in this situation. And the adaptive and resilience are two keywords for response this pandemic. Okay, we are very on time from the beginning until the end. Thank you very much for ladies and gentlemen. Sorry for not answering to all your questions, but you can engage directly to our speakers. And I hope we can meet again in our next seminar. If you want to see what CSEAS will have in the next, for the CSEAS event in the next event. So you can see our website or our social media through Facebook, Twitter, and LinkedIn named CSEAS Indonesia. And stay healthy. Bye-bye. Thank you.